The very first misconception about our facility is that we're only here for tribal members, and that's not true. We are open to the general public, and we feel so strongly about being good partners, not only here, but with North Lakes and with the whole region. So, and the other thing I want to share is that while we're a community health center, community is really the important part for us. So we're much more than the services that I'll talk about. We have a lot of services that reach beyond the medical services that are in this building. But I do want to make sure that I do let you know what we have in the building in terms of services. And then I want to share a little bit about an event that we're having that everybody is, this is open to everyone, so I want to make sure I get to this. But we do have a comprehensive medical care. We have primary care. We have an MD. Dr. Ann Wrights just joined us. She's our medical director, and we found her in Port Wing. Like, wow, we found our doctor in Port Wing, so we're excited about that. She joined us in July. We have a physician assistant, and for anybody that has little ones, grandkids, we have a pediatrician on site. We have full physical therapy. We have chiropractic, we have optometry, and we have behavioral health, all of those services. For the dental services, again, we have a general dentist, we have hygienists, and we have, again, for those little ones, we have a pediatric dentist. He's the only one in the area that does the services over at MMC in the operatory. We don't have that anywhere. Most families were having to travel to Wausau, some down to the Hudson area. So we're very excited. He's been with us for about a year now. So again, share that. He still is bringing, he does do routine care here as well for the little ones. So we want to make sure that people understand and know about the services that we have. We also have a really strong public health. So when you need those flu shots coming up, we're going to be having flu shot clinics, and you're all welcome to come and get that. The biggest part for the flu shots, and we will be having a health fair in November. So we open up the whole facility, and we have a lot of activities. We share information. We offer flu shots. We offer health screening. And all of that is, the health screening and all the information is free of charge. But come and get your flu shots when you need that. You'll see more information. And we have lab and x-ray as well. So before I go on to some of the other events and other places that we have, are there any questions that I can ask just about services?
Can you talk about the pharmacy?
I can talk about pharmacy. When we moved into this facility, we have 2 full-time pharmacists and 3 techs, and it's state-of-the-art in there. And you are able to, that's a really good point I want to bring up about pharmacy, is you don't have to come and have the whole package. If you have prescriptions and you're traveling to Washburn or Ashland to Walgreens or Walmart, you can have those prescriptions transferred here, and we're convenient. So then you can come out here, particularly in January or February, and you're having to drive over to Ashland for those prescriptions. Who wouldn't want to just come out here? So in terms of our pharmacy, we have, I also want to say in regard to that, in our medical, we hold contracts with Medicaid, Medicare, the majority of your commercial, Blue Cross, Blue Shield, Medicas, the insurances that are in the marketplace, Security Health, we have contracts with them as well. If you call us and talk to our business office and you have an insurance that we don't have a contract, it's likely that we will attempt to get that. So we try really hard to be able to service just like any other facility. But with our pharmacy, I just want to talk a little bit about some of the technology that's in there, and you can't see it if when we do a tour if you're interested, is we have a robot in there. So we have the same conveniences that your Walgreens do and your Walmart. You can call in your prescription. 10 o'clock at night, and our system will pick it up and it'll transfer it to the robot that will fill it, and then our pharmacist will check that. By law they have to, so don't think it's just the robot. The pharmacist will check that and verify it, and then it'll be ready. So again, we can compete with, in terms of customer service and quality, with all of the other facilities that are in the area. There any other, Kurt?
I see in Washburn, kind of across the highway from the post office, there's a building there that says Redcliffe Community Health. What's going on there?
That is our newest satellite office for behavioral health. And so what we just opened the doors to that in June. We used to co-locate with North Lakes, and we consider ourselves like sister community health centers. So we used to co-locate with North Lakes in the Thompson Road building, but we had enough growth that we opened our own satellite office, and we offer mental health and also AODA, or alcohol counseling, in there. But again, just opened the doors in June, so we hope to not only expand behavioral health there, but also maybe talk to the city of Washburn, because I said we're just dipping our big toe in the water to see what the need is over in Washburn. Two other things I want to talk about before I get to this is we have two other facilities, and they are up Blueberry Road, about 1.5 miles. The first one is called the Mashoma's Wellness Center, and that's where we have our AODA, our alcohol counseling. They can do some other things, and we have some groups in there. We have a couple of federal grant programs. We have a suicide prevention program. We all know how important that is to get the word out. They're also working in the schools. We just started working in the school, the Bayfield School District, with skill building and character building, and just to help our kids maneuver through that challenging part of being in high school. The other thing is we have the newest one we have is called the Nuji Drop-In Center. And we opened that in July. And what that is it's open to the general public. Also, it's a safe and sober place if somebody's in recovery and maybe they've just come out of treatment, maybe they've come out of incarceration, and they need to have something else to do versus what they did before. So that's a place where it's open 7 days a week, and we have games. We hold the AA meetings there, the NA meetings there, the Wellbriety meetings there, but there's also teen game nights. So families can come in, they can have fun with their kids in just a different environment. So that's the newest one that we have. Are there any other questions about those?
I would just like to say I had an experience with your premises over the summer with a friend that was terminally ill, and they are so caring and wonderful, and you know, so considerate. I have nothing but good things to say.
Well, thank you so much. I'll make sure that I share that compliment with them. But they are, and I think that's what you'll see through most of our organization, or all of it, is that the compassion to serve and to make sure that people get what they need. It's not getting people through the system, it's really about taking care of people. The last thing I want to talk about and make sure that you all have this information is we have a project the first week of October, and it's called Operation Walking Shield. And on Monday, October 1st, so Walking Shield is an organization that partners with corporations, they partner with the military, and this particular project is the charitable arm of Lens Crafters. But what they're going to do is they're going to bring 30+ optometrists, and we're going to set up at Legendary Waters. So thank you to the casino for allowing us to set up there. This is a project. And they're gonna offer free eye exams and free glasses. Monday we can accommodate about 400 adults. So you do have to pre-register. There's information here. It's open. This is not a tribal. It's open again to anybody, non-tribal. Doesn't have to be on the reservation. So we want to make sure that you know about this. And then the rest of the week is going to be for children. So we're working with the Bayfield School District. So if you know of any kids, the paperwork has gone out to the Bayfield School. And so we're just collecting that back. In the end, they want to do 1,000 eye exams and glasses. They're bringing the lab right with them. And so most of our littles, our children will get their glasses same day. For those of us that have the bifocals and maybe a little more challenging prescriptions, those glasses will be delivered back to us within 7 to 10 days. There's still a question they might bring the lab for the bifocals as well, but because that's unknown, we're still planning that 7 to 10 day turnaround for those. So I really want to offer this to each and every one of you and the people that you know to call here and get the form and get pre-registered for this. And the way it's going to work, I think, I have one of our staff members that's actually organizing this for us, is that they're going to do 70 eye exams per hour. I know, so I'm still thinking logistically how that's going to work. So they're set up in hour blocks, starting at 8:30, I think, and running through like 1:30 or 2:30 with 70 per hour. So again, I want to make sure, again, talking about how we're a partner and we feel strongly, please take advantage of this if you know anybody that would like to sign up for this. With that, are there any other questions for me? And after this is done, if anybody would like a short tour, I won't give you the full thing. It's a 38,000 square foot facility and we can take 45 minutes walking through here, but just to see the medical side, if you're interested, I would be more than happy to do that. Okay?
I just briefly want to mention that I just made a couple of copies of both the adult and youth forms for the Walking Shield event. So
all right.
Feel free
on the ball.
to
There's
take one of each and copy at your delight, or take one for yourself. So they just need to be returned. The most important part is you can scan it and return it back, or have it mailed. But pre-registration is critical, as Diane was mentioning. With those pre-registrations, we'll be able to set those appointments and get back to you with the time that you should arrive, either yourself or your children or your little ones. So help yourself.
And as you can imagine, this is a logistical giant. So the quicker we have those forms, we have to enter them in. Elizabeth, here's the forms, one for children, one for adults. We have to get them all entered into their registration system. So again, please take forms and share them with people and just get them back to us as soon as you can. Thank you, everybody. Again, thank you for coming.